Welcome back, and I'm seated now for obvious reasons. We will be going to Benin City to speak with the Executive Governor of Edo State, Governor Godwin Obaseki. You're welcome to the program, Governor. I hope you can hear me clearly.
Thank you. Yes, I can. Thank you very much.
All right. First of all, we'd like to thank you for the work you are doing on behalf of your people and also of the Federal Republic of Nigeria.
Thank you. It's my pleasure.
All right. The first question we're going to ask is this. As Chief Executive Officer of your state, can you just give us a status assessment of the impact of COVID-19 pandemic in your state? What are the structures that you have put in place to stop the spread of this virus
I have lost you. I
as
can't
we
hear you.
enter
Can you
into
hear
the
me?
phase of gradual reopening of the economy?
Sorry, I didn't. You broke for a while. Can you just repeat the question?
Okay. As the Chief Executive Officer of your state, can you give us a status assessment of the impact of COVID-19 pandemic in your state? What are the structures that you have put in place to stop the spread of the virus as we enter into the phase of gradual reopening of the economy?
Thank you very much. As you know, Edo State occupies a very strategic geographical position in this country. Logistically, you cannot go from the western part of the country to the east or to the south, and sometimes to the north without going through Edo. So it's a logistic hub, it's a transportation hub, and quite a bit of our economy is dependent on our location. And so with the lockdown and shutdown across the country, you can imagine the impact on transportation, on logistics, on supplies, on the whole value chain that our economy supports. Also, don't forget that we have a very large diaspora, particularly in Europe. And at the advent of COVID-19, we realized that quite a few of them started coming back home, and that created a scare for us because we did not know how many came back infected, and many of them did not go into self-isolation. On the social side, I mean, you know how boisterous our people are. Edo perhaps ranks amongst the top locations in terms of the evangelical religious movement in this country. So people are very, very religious, so they love going to church. And so with the pandemic, all of that, religious activities, economic activities, social activities, just all came to a grinding halt. The population in Edo the economy is largely dependent on the informal sector. Quite a lot of service going on to support the economy I have described. So with the pandemic and the shutdown, you can imagine the economic hardship our people have faced. And so as Chief Executive, I had to make a very difficult decision between a panic reaction of just shutting down the state entirely without understanding how I could support the livelihoods and economic activities, and ensuring that I protect and safeguard the health of my people. So it's that delicate balance that we have tried to maintain. And in doing so, we decided to develop a very robust approach to fighting the pandemic. And we approached it from three main perspectives. First, governance. Everything in life, every process you need to undertake depends on the governance structure you put in place. So I'm very happy to say that you have a very robust governance structure to fight COVID-19. I have a response team I chair, and I meet with every day, and we've done so for the last 4 weeks, to develop plans, strategies, and programs. The other pillar, or the other key factor has been partnerships. We know that we cannot do it ourselves, so we've thought about leveraging on the partnerships we have. Fortunately for us in Edo, we have 3 strong federal government health facilities: the University of Benin Teaching Hospital, the IRWA Specialist Teaching Hospital, and the Neuropsychiatric Hospital. With the manpower that is available in these institutions, coupled with a very rich pool of private medical practitioners in the state, we've been able to leverage these human resources to develop a very robust plan. The last aspect of the strategy focusing on communication, because over the last few years, we commenced a reform in the state where we ensure that we reach our people, we build trust with our people. Majority of people in the state now believe that government means well, and that believe that government will look out for their interest. So we've emphasized communication, trying to make sure that our people know and realize that COVID-19 is real and portends great dangers for us. In organizing the way we responded, we looked at the entire spectrum and created 6 pillars to respond. The first was to focus on people, the manpower. And like I said, fortunately, we have a rich pool of medical personnel in the state, ranging from specialist consultants in teaching hospitals to doctors in the public and private hospitals to community health workers at the local government level. We've leveraged the entire spectrum and pulled them together and began to sensitize and train them on how to respond to COVID-19. We were able to train about 4,200 health workers about 4 weeks ago, the first, when we set up the committee. And we've continued to, adopt the trainer system and have ensured that as you get, even at the local government levels, at the primary health care centers, we have trained all our health workers. So they all know what COVID-19 is about. We've given them protective personal equipment. We've given them support to cope with the pandemic. We also focused on making sure that we have the facilities to treat people. And I'll tell you later the strategy we've adopted. Mm-hmm. We looked at private clinics, we looked at hospitals, we looked at private providers, private clinics, and even pharmacies. And right now we're talking to patent medicine stores that have a large pool of people who come in to buy medicines. And we've set up screening centers in most of these facilities. Our goal is to roll out between 200 and 300 screening centers across the state. We rolled out the first 40 in the south, where we have a lot more of the cases. And the plan is in the next 2 weeks, we should be able to roll out the rest of the screening centers. From the screening centers, we have a technology where we collect information from people who are screened, and where we find cases or suspected cases, those samples are taken, tested, and while that is happening, we triage them into health facilities to watch them before the results come in, and if they are positive, then we take them to our isolation center. Today, we have isolation capacity of about 500 beds spread across the state. We have the main isolation facility, which is the Stella Obasanjo Hospital. I had to evacuate everyone from that hospital to set up a 300-bed isolation facility. That facility is up and running, and we still have some work to complete the ICU and a few other things in there. But by the end of next week, it will be fully ready to accommodate 300 people. We also have isolation facility at the University of Benin Teaching Hospital. I went there a couple of days ago to provide additional support for about 50 beds. We have an isolation center at the Irua Specialist Hospital in Edo Central. And we've also built an isolation center at the Auchi General Hospital in Auchi. The other thing we've done about the facilities we have is to focus on testing. We are fortunate in Edo, like I said, to have a strong federal medical presence. And as you may know, the Irua Specialist Teaching Hospital is one of the centers of excellence on the continent for infectious diseases. A couple of years ago, we partnered with that hospital, put in some state resources to strengthen their capacity to respond to Lassa fever. They helped in training quite a lot of our community health workers. And today in Edo, are proud to say that we have some of the best contact tracing teams in the country. And that's why we were able to quickly respond at the beginning of the outbreak to track potential cases.
All right.
So I could go on and on and on. You know, we've done so many other things, including ensuring that we have a very strong logistic support for the operations, ensure that we organize security to back up what we're doing, and the core and kernel of the two key things that are critical in the success, that will determine your success in the fight against any pandemic. First, how you communicate what you're doing to the people who are affected, and how you get feedback. So communication has been very, very strong. And in this regard, again, we partnered with all the media, you know, bloggers, radio stations, public or private, television stations. We use the town criers from, you know, the local government down to the communities. So we leverage every communication platform we have to ensure that we get the message down. And then lastly, the kernel of any response is your incident management. When you hear of cases or you have suspected cases, how do you go to ensure that you're able to reach those people? Where you have people who have tested positive, how can you quickly trace every contact they've been in touch with and quickly bring them for testing, and also in doing, and making sure that you also bring them to care and treatment. And in doing this, you have to show empathy. You have to show concern. You have to show, love. I guess the last word, last point I want to make is that the messaging about COVID-19 is key and real. It's key. Because what we found is, in the beginning, you tell people, yes, wash your hands, keep a safe distance, and they didn't really understand why. So we had to break it down to explain that this is what happens. This is the nature of the virus. If you wash your hands regularly, even when you touch surfaces where where the droplets are, you may not be affected. But more importantly, we then gleaned from the experience of countries where they have successfully fought this virus to make sure to insist that we should wear face masks. So in Edo today, I believe we're one of the first states in the country to make the use of face masks in public spaces compulsory. And we've facilities without wearing your mask.
All right. You actually have answered a lot of the questions we're going to ask with your detailed explanation. So I'll ask this on the economic front, because this pandemic has the balance between the health and then the economic front. On this economic front, this pandemic will no doubt have had some significant impact on people's lives, especially with the lockdown. So can you just tell us your strategy to ease the negative effect on business activities within your state, and also to reduce the economic impact on the citizens? Are there things you're going to put in place for this?
Yes, as I said when in my opening remarks, that the economy of Edo State, first, it's largely agrarian. Secondly, it's also, because of the strategic location of the state, it's also service dependent. And most of the people who provide services or grow food are in the informal sector. Yes, we have a few large plantations, but the rest of the agric value chain is driven by smallholder farms, small farmers who operate in the informal sector. So if they don't go to work, if they don't farm, or they don't sell, they are not going to be able to fend for themselves. So that, and 80% of the economy of the state is dependent on these people, and 80% of the employment in the state is driven by the informal economy. So that informed our decision to undertake gradual restrictions. That is why we did not, despite all the pressure, enforce a total lockdown of the state. We did, gradually shut down a few most important, areas where people aggregated the largest. Schools, public servants from level 1 to 12 work from home. We relocated markets from where they really are to open spaces to be able to enforce social distancing. But we kept them open, and we've kept all of them open. While not encouraging people to try and stay at home as much as possible, for those who had to go to work, we just said, look, try and protect yourself. Make sure you wear face masks. I think our whole strategy has been to ensure that our communication to our people, to make them understand that fighting COVID-19 is a shared responsibility. It's not the sole responsibility of government. Government will provide leadership and direction, but the disease will affect individuals and families. So they must also take an interest and understand how to cope. Government does not want to punish them, by shutting down their businesses, by starving them. If they must go about their economic activities, then they must protect themselves. So that's the approach we used, and we did not shut down the economy wholesale. The transportation, the people who run the transportation industry, the buses, the transporters are allowed to, as long as they enforce social distancing within their buses and vehicles. We also looked at the issue of palliatives, but clearly with the lockdown, many people were thrown out of work. Imagine the young man who hawks bread to the transporters coming in from Lagos on their way to Onitsha or to Port Harcourt. Those people have been out of work for close to 6 weeks, and they need to survive. And so for people like that who have become vulnerable, who have been driven further down into adverse poverty, we've provided palliatives. We have a relief committee, and using state resources. It's only in the last few days or weeks that we've been receiving support in terms of food and medicines, but we had to do something before we got to get support. We've bought food stuff, and we've got some cash, which we have tried to distribute to the poorest of the poor, the most vulnerable. And we've done that through the churches, who have been very, very supportive. All the church leaders in the states meet with me regularly, and they have supported our efforts and our fight. Our fight in this area. We've also used our traditional system. We have very robust traditional administration, as you know, from the palace down to the dukes in the various areas and down to the heads of communities. We've used them to identify those who have become very weak as a result of the pandemic and to try and bring succor and support. And in the last 1 week, we've also, deepened the message, to say, look, people should be their brothers' keepers. Everybody needs to give something to support those who are weaker. So palliatives shouldn't be dependent only on government or only the very wealthy in society. My civil servants who received salaries, last month, for instance, and asked them, what are you doing? How are you giving to support those who have not been able to earn any income? So we've approached the economic sustenance from first ensuring that we don't shut down everyone totally, making sure that the restrictions have been gradual. The only major restriction we have now is a night curfew, but during the day, people are allowed to go about their economic activities, albeit ensuring that they maintain effective social distancing. And then for those who have been hardest hit, we've been sending them relief materials. And what we've now decided to do, or working with some of the telecommunication companies, is drawing up a very elaborate and robust social register. I'm working with the 4 telecom companies. We've gotten data. We know those people in our state who cannot afford more than about 300 naira a month to recharge their phones, who have analog phones, or who don't even have phones, they only have SIM cards. We're identifying those. We have about 125,000 of them now. And we're going to, working with some of our financial institutions, we're going to create electronic wallets to see how we can navigate to transfer money to them until we get out of this unfortunate situation.
All right. Thank you very much, Governor. Thank you for lending us some of your time during this most busy time for executives. Keep up the good work, sir.
Thank you.
And God bless you.